Good morning, friends, and welcome to NPTEL Anti-Doping course. This is the week 2 lecture 4 session, and I'm Professor Dobson Dominic. Today we are going to look into the World Anti-Doping Agency's prohibited substances, the side effects of it. The previous sessions we looked into what are the WADA banned substances and banned methods. In this session, we look into the side effects of various prohibited substances. So, several substances are banned by World Anti-Doping Agencies due to the harmful side effects. So, we are going to look into the gender-specific side effects, and we are also going into the short-term and long-term side effects of the banned substances. The main one which is banned by World Anti-Doping Agency, the first substance is anabolic agents. There are several examples of it is tanosolol, nandrolone, DHEA or dihydroepiandrosterone. Testosterone group of drugs comes under this anabolic agents. Athletes use this as a performance enhancing drug to increase muscle mass and strength. There are several side effects of anabolic agents. The gender specific side effects are, in males it causes breast development, testicular atrophy. It also causes diminished male hormone production, that is testosterone is reduced, diminished sperm production leading to impotence. It also can cause alopecia or hair loss and very harmful dangerous prostate cancer. These are all the males specific side effects of anabolic agents. What are the female specific side effects? In females, anabolic agents can cause male pattern hair growth, and also it can cause baldness or hair loss, extreme hair loss. In females, it can also cause menstruation disturbances or menstrual cycle imbalances. It can also cause decreased size of breast, and it can cause hoarseness of voice. So, anabolic agents has a widespread gender specific side effects in both male and females. What are the systemic side effects of anabolic agents? What do you mean by systemic side effects? Systemic means it can cause side effects in the internal systems like cardiovascular system, respiratory system, central nervous system, gastric system, dermatology system. So, let's look into the systemic side effects. The predominant systemic side effects are greasy skin. It can cause skin effects like acne, male pattern baldness, extreme hair loss, infertility in the reproductive system, hypertension is a harmful side effect in cardiovascular system, liver and kidney dysfunction, very dangerous, deleterious effect. It can also cause central nervous systemic side effects like aggressive behavior, depression, and even harmful suicidal thoughts. Endocrine, it can also cause tumors. So, the second substance which is banned by WADA is peptide hormones and growth factors. Examples of which is HCG or human growth hormone, human chorionic gonadotrophin HGH, insulin, adrenocorticotrophin ACTH, or EPO. These substances may be illegally used by athletes to counteract undesirable side effects which are associated with drugs like anabolic steroids. Look, when athletes abuse anabolic steroids, male athletes can develop gynecomastia. So, this is an undesirable side effect. To mask this side effect, to overcome this side effect, athletes inadvertently use, along with anabolic steroids, they also use peptide hormones. What can it result in? This side of it can result in a lot of side effects on hormones, hormone antagonists and modulators. The side effects are hot flushes. It can cause severe gastrointestinal disorders. It can cause fluid detention, and extreme causes, it can even cause venous thrombosis. Let's look into the individual side effects of peptide hormones and growth factors. Side effects of human chorionic gonadotropin can cause menstrual disorders in females. It can cause gynecomastia or breast development in males. Side effects, what are the side effects of insulin? It can cause hypoglycemia, it can cause nausea or vomiting, it can cause drowsiness, extreme sleepiness, and it can even cause a brain to malfunction. These are all side effects of insulin. Side effects of ACTH, it can cause extreme insomnia, lack of sleep, hypertension, it can cause diabetes mellitus, and in extreme conditions even osteoporosis or bone loss. These are all the side effects of ACTH. What are the systemic side effects of peptide hormones and growth factors? Side effects of EPO are, it can cause increased viscosity of blood, blood becomes thickened. It can cause hypertension. In extreme conditions, it can even cause MI or heart attacks, cerebral infarction, pulmonary embolism, and convulsions. Side effects of human growth hormone, it can cause overgrowth of limbs or acromegaly. It can cause soft tissue swelling, abnormal growth of organs, arthropathies or joint disorders. It can also induce diabetes mellitus. Next group of drugs we are going to look is one of the ancient most abused performance enhancing drug, commonly abused by cyclists and endurance runners, is S6 stimulants. What are the examples? We have already looked into it: amphetamines, cocaine, ephedrine, all CNS stimulants. These are all predominantly medically used to treat conditions like ADHD or attention deficit hyperactivity disorders in children. It's also medically used to treat narcolepsy or sleep problems. The athletes predominantly misuse this drug to increase alertness and reduce fatigue. So these are all very useful in long distance endurance events. Stimulants have also been found to be adulterated in supplements, which are commonly found over the counter drugs and in supplement stores. So it is very important for any athlete to, if you're going to take stimulant, consult with a sports medicine doctor before taking these drugs. So side effects of stimulants, if you look, if an athlete after consuming stimulant performs for long periods in heat, then the athlete's thermal regulatory mechanisms malfunction. What happens? It results in cardiovascular system and other vital organs like liver and kidney also to start malfunctioning. This is one of the very dangerous side effects of stimulants and can even cause death. The other side effects of stimulants are all loss of appetite, insomnia, loss of sleep. It can even cause euphoria or increased hyperactivity if you take the stimulants in a large dosage. It can even in extreme condition cause hallucination or psychosis, trembling, tremors, restlessness, agitation. It can cause tenseness in an athlete. Other systemic side effects are hypertension, palpitation, and heart rhythm disorders or arrhythmias. Hyperthermia is again a dangerous side effect of stimulants, which is basically increase in body temperature. The next banned substance we are going to look is narcotics. Some of the common examples are morphine, codeine, oxycodone. These are all commonly present in the over-the-counter cough syrups. Narcotics are prohibited in sports predominantly as they are derived from morphine and its chemical and pharmacological analogues. How it acts, these substances act on central nervous system and reduce pain feeling. Use of narcotics can give a false sense of cure in an injured athlete. What happens during rehabilitation phase is when an athlete is injured for a long period of time and he is away from the sport, it can cause the athlete to be very anxious and he or she wants to get back into the sport pretty fast. And due to the ignorance of the potential harmful effects of narcotics, they may misuse this, and this can actually lead to further serious injury, risking further damage. The next group of drug banned by World Anti-Doping Agency is narcotics. What are the main side effects of narcotics? Narcotics can lead to addiction overdose risk. It's very common. Addiction is something which is very common in narcotic abuse. Athletes who use narcotics can also have loss of balance and coordination. Common side effects are nausea, dizziness, insomnia. It can lead to depression, decreased heart rate, bradycardia, and also respiratory depression. These are all some systemic side effects of narcotics. The next substance banned by World Anti-Doping Agency is cannabinoids. Cannabinoids are basically psychoactive chemicals like marjuna, hashish oils, which are predominantly derived from cannabis plant. Examples of cannabinoids are THC or tetrahydrocannabinol, predominantly misused by the athlete for pain relief and also to reduce anxiety. One of the main side effects is prolonged use of cannabinoid may result in athletes becoming loss of motivation, decreased concentration, impaired memory, learning disability, even in extreme cases respiratory diseases such as lung carcinoma, lung cancer, throat cancer, and chronic bronchitis. These are all harmful side effects of cannabinoids. The other side effects of cannabinoids are impaired balance and coordination, loss of concentration, increase in heart rate tachycardia, increased appetite, drowsiness, hallucination, several cognitive impairment. It can lead to extreme dependency, anxiety, and paranoia, or getting scared for even common things. The next group of drug substance which is banned by WADA is glucocorticoids. Examples are prednisone, dexamethasone, which are predominantly medically used as anti-inflammatories and very commonly used by sports doctors to treat musculoskeletal injuries. All glucocorticoids are prohibited when administered by injectable form. So, injectable glucocorticoids are banned. Also banned is oral including oral mucosal like buccal, gingival, sublingual, or even rectal routes. All these forms of administration of glucocorticoids are banned by WADA. The other routes of administration like inhaled glucocorticoids, topical glucocorticoids, dental procedures, dermal procedures, intranasal, ophthalmological are all not prohibited when used with proper certification, that is therapeutic use exemption. You should have a valid TUE certificate. The athlete and the support staff should apply for that before usage of glucocorticoids through other routes of administration. Now coming to side effects of glucocorticoids, the predominant main side effects are fluid retention. So athlete might develop edema in the foots, hyperglycemia, systemic infections are pretty common, musculoskeletal disorders might arise, osteoporosis or bone loss, high blood pressure, hypertension, athletes' immunity becomes compromised, increased blood sugar levels, that is hyperglycemia, moods, athlete can also have CNS symptoms like mood swings, depression and anxiety. The other group of banned drugs like diuretics and masking agents, common examples being furosemide, hydrochlorothiazide. This is one of the masking agent with which the famous cricketer Shane Warne, the legendary leg spinner who passed away from Australia, he got caught using diuretics. He was given this by his support staff to overcome obesity. Okay, so the main side effect of diuretics is it causes increased urine output. Athletes use these drugs as form of PEDs or performance enhancing drug to mask the usage of other drugs. The common side effects of diuretics and masking agents are it can lead to extreme dehydration, very common in people who go for extreme weight loss programs. It's very common. Electrolyte imbalance, kidney damage if used long term, muscle cramps in short and medium term, low blood pressure, hypertension is also one of the side effects of diuretics. Now coming to beta 2 agonist, example clenbuterol, salbutamol. These are predominantly misused by athletes to enhance the muscle growth and to stimulate weight loss. Side effects of beta 2 agonist are tremors, heart palpitations, arrhythmias, muscular cramps. The next group of drug we're going to look is beta blockers. These are particularly banned in precision sports like archery and shooting. These drugs are used by archers and shooters because this sports requires accuracy and also a steady still limbs. Examples of beta blockers: alpranolol, atenolol, acebutolol, betoxolol. The common side effects of beta blockers in athletes is it can cause hypotension, decrease heart rate, bradycardia, and as a result athletes can get fainting episodes. So these are all the common side effects of the WADA banned substances and WADA banned drugs. So in conclusion, the take home message is most of the drugs and substances banned by WADA has both short-term and long-term side effects, and these side effects are gender specific both in male and female, and this can also have short-term side effects depending upon the usage and long-term side effects if the athletes misuse over a period of time and if there is addiction. Long-term side effects, severe cases can even lead to organ damage like kidney, liver damage, hormonal imbalances, mental health disorders like depression, anxiety, and in severe cases, even risk of certain carcinoma or cancers. These are the references predominantly taken from World Anti-Doping Agency sites. Thank you and Jai Hind.